they might come and see me is with the other neurodevelopmental conditions. And so with that learning profile, it might show that the child can't concentrate, or you as a parent or the teacher might identify this. And about 1 in 10 people, so quite a lot, have differences in the brain, especially near the front, which leads them having difficulties concentrating, sitting still, and reining in their impulses.
Right.
Yeah. And so what that can look like in the classroom is someone who's sort of staring out the window, talking to their friends, constantly getting up, not really achieving their potential academically. You know, you can be incredibly bright but have this difference. I mean, Einstein had it. And those kind of features would relate to a condition called ADHD, Attention Deficit Hyperactivity Disorder.
Okay.
And there's a lot of misgivings about ADHD. People often think about it as an issue related to parenting or lack of boundaries or the child being spoiled, whereas it is as neurological as dementia. And we wouldn't look at dementia or older people with dementia and say, oh, someone's not done something right for them and that's why they're forgetting everything.
Yeah.
We know it's related to their brain. And the same thing with ADHD. We know that there's differences in the brain that create a difference in how many chemicals are in that area that leads to a lack of self-control. There's a lot of variability in that. So if a child does something they're interested in, they get a surge of chemicals and they can concentrate. And that can be very frustrating for a parent, that you see them playing video games for hours, then you ask them to do their maths homework and they don't. And it looks like they've got a choice in that, but they really don't.
Wow.
Yeah, and nowadays we have so much tech. Tech is really designed to increase our dopamine, serotonin in that area, noradrenaline. And those are the chemicals that give us more control. And so for kids these days with ADHD, as opposed to when we were young, there's a lot of times where they can concentrate really well because they've got iPads, phones, video games. It mimics what things like the medication can do in terms of helping them gain control again.
Right.
And so with kids like this, it's very important to figure out whether there is a difference in their brain, because what you don't want to do is label them as naughty or bad or lazy, and these are the things that can follow kids with these kind of differences there. And that's something we would assess, diagnose, and then talk through the treatment options, which are medication as well as behavioural changes that can be done within the classroom to try and help them, or at home to help them. When you've got a difference in the brain like these, you're more likely to have others. So that's another important thing, that if somebody identifies something like dyslexia or dyscalculia or ADHD, it's really important to check that they don't have the other differences that coexist.